Coronavirus. This is an issue of concern to many. And to learn more about it, our Walk the Talk show is here to meet Dr. K.P. Raman, well-known medical professional and chairman of Al Haya International Hospital. Good morning, doctor.
Good morning, Mr. Shaddad.
Yeah. In short, what's coronavirus?
Coronavirus is a virus very similar to the virus which causes common cold. But there are two differences. The coronavirus spreads much faster than the virus of the common cold. And the second difference is that coronavirus is more dangerous than the common cold virus.
How different is this virus compared to other?
Well, common cold virus is not dangerous, I said, because 99.9% of the people who get infected with common cold virus will recover completely. But with regard to coronavirus, up to 2 to 4 out of 100 people who get affected can die, especially the old people.
So, Dr. Raman, what's the best advice you can give in order to be safe?
The advice to the public can be summarized under two headings. One, personal hygiene, and number two, social distancing. Personal hygiene means that you have to take care of the personal hygiene of yourself, like washing the hands frequently with soap and water, and if that facility is not available, use the alcohol-based sanitizer. And then when you come in contact with patients with flu-like symptoms, it is better to wear the mask yourself, or the patient with symptoms should wear the mask. One should avoid physical contact with other people, avoid the handshake, and also one should not touch the face of one's face with his hands, especially the nose and the mouth.
Raman, how does sneezing spread the virus?
Okay, when the patient sneezes, he produces droplets. These droplets contain virus particles, and these droplets may fall on the nose or mouth of the person in front of him, or it may fall on the surface. If it falls on the surface, the virus is alive up to 24 hours, and someone else comes and touches the surface, and then he touches his nose, the virus is transmitted.
And Dr. Raman, is it helpful to wear a mask, and how does it help?
Of course, it is helpful. As I said before, when the infected person sneezes or coughs, the droplets fall on the face of the person in front of him. In order to protect the droplets falling on one's face, you can wear the face mask, and definitely it helps.
And is it necessary for public to wear masks now at the moment?
I think at the moment it is not necessary, but if you go to a place, crowded place, and also if you go to a hospital where there are likely to be patients, then it is better to wear a face mask. The infected person should also wear the mask so that he does not spread the infection to others.
Now the world is in panic. As a medical expert, do you think there's a need to, how concerned are you?
Okay, actually there is no need to panic. At the same time, everybody should take it quite seriously because it is a pandemic. Almost everyone is likely to get infected over a period of time. But as I said before, in the young people, most of the people who get affected will recover. But the problem is the old people. The fatality rate is quite high in old people. The affected person in the house should quarantine himself or isolate himself at least for 14 days because the person continues to be infective even up to 14 days after recovery.
Dr. Raman, thank you very much for
Thank you, Muscat Daily.
Thank you.